Welcome back to the Psychological Paradigm Shift. I am Ed Rieger, your host. I hope you found the last episode informational and helpful. Always remember, I'm only providing my personal opinions based on my experiences and education on psychological topics. We will be talking about mental illness in a very blunt and transparent manner. The topics may be disturbing to some, and it will never be my intent to hurt anyone, only to share my ideas and thoughts. Tonight, we're going to cover psychological treatments and the questions you may want to ask a romantic partner. I think this topic is extremely difficult to talk about for everyone. Some of the events of psychological treatment may have been a traumatic event for the person that you're trying to date, especially if they were very young. Many of these wounds may be too difficult to address with anyone, even themselves. Remember, when dating or planning to marry, you must know as much as possible about your potential partner as you can before you make that lifelong commitment. Knowing their current psychiatric status, their history or possible treatments, their family's history will be very important in your assessment of how to move forward with them. You don't want to need any surprises in 6 months from now, 1 year, 10 years. I think some of the information we're going to discuss in this episode are giant red flags. Fog lifters are most likely going to be very comfortable with this discussion, but chaos chasers may deny. Let's talk a little bit about how big psychiatric conditions are in the U.S. and the world to get a full picture of what we're dealing with. Remember, the majority of people may never seek treatment and receive a proper diagnosis for 1,000 different reasons. So what is the most common mental health issue in the United States? Anxiety, major depression, bipolar disorder. Those are the top. The APA, or American Psychiatric Association, estimates that 20% of Americans will suffer from a diagnosed mental disorder annually. When you have 340 million Americans, that's about 68 million people. Now, how many of these people have power over others? From being a parent, guardian, romantic partner, spouse, sibling, employer, religious leader, social leader, political leader. How many people can they infect with their mental illness? How much damage can they do emotionally, financially, spiritually to themselves and others? Globally, this is a large problem. It is estimated that we spend about $7 trillion worldwide combating mental illness with treatments and medications. The top 5 countries for depression are China, India, United States, Brazil, and Bangladesh. Kind of interesting. China estimates that over 170 million Chinese suffer a mental disorder annually. Their most common illness is depression and anxiety, just like the U.S. India estimates that over 197 million Indians suffer a mental disorder annually. The most common illnesses are depression and anxiety, just like the U.S. 1 in 6 Americans take a psychiatric drug every year. In 2020, that was about 16.5%, or 56 million Americans. The 2 most common categories are antidepressants and antisuppressants. We spend about $22 billion a year on psychotropic medications in the United States. And America spends about $280 billion a year on psychiatric treatment and facilities. It is estimated that we spend over $1 trillion a year when you add in lost wages, policing the activities of the mentally ill, incarceration, foster care, judicial processes. I could go on and on. When discussing psychiatric treatment issues with a potential romantic partner, be aware that this is one of their personal and family secrets that they do not want to expose no matter what. And with the world blabbing everything on Facebook all day long, you might understand why they don't want to share this information so freely. This may not be the questions you ask on a first date, but it's definitely questions that you need to get to eventually. Always remember that the majority of people with psychological issues may never have received a diagnosis or treatment, especially if they are poor or were poor growing up. There's a lot of undiagnosed folks out there that you need to accept and be aware of. Okay, so let's begin with the questions. Have you ever been diagnosed with a psychiatric disorder? You can see this is a tough question to answer if you are just dating casually. If they answer yes, then at least you are talking to someone who has accepted they may have an issue and sought treatment or been helped when they were a child, and they're willing to communicate openly with you. When were you diagnosed? What were you diagnosed with? They may be very careful in answering this if they answer it at all. Was the disorder considered genetic? If you are planning to have children with them, you'll need to know this. At what age did they diagnose you? This is going to give you a window into how long they've had the diagnosis and did their parents help them through the process. Have they ever been in therapy? For how long? Did you find it helpful? Knowing their attitude and outcome will be helpful to you in knowing was it positive or a negative experience. Have you ever taken medications for a psychiatric disorder? If someone doesn't trust you, they may not answer this, especially if they think you may try to use the information against them one day. And their paranoia may be justified in certain situations, so be careful there. Are you currently taking medications? Again, they may not want to answer. Are you currently in therapy? Nowadays, some people brag about their therapy sessions like they went to the grocery store. How long have you been in therapy? Have you found it helpful? Have you ever been hospitalized for a psychiatric issue? How long was your stay? How many times have you been hospitalized? Have your parents or other family members ever received psychological or psychiatric treatments? For how long? Were they ever institutionalized? Was your parents' disorder considered genetic? These are some important questions that you definitely need to ask through your dating process. You can see a lot of these questions are extremely straightforward. If your romantic partner feels extremely comfortable and safe with you, they will share this sensitive information. I think getting this information before you make a full commitment to someone is critical. You must know their psychiatric history in order to determine how serious of an issue you may be getting involved with. This is where compassion and empathy are needed while dating. But you must protect yourself from the possibilities of what their disorders and behaviors might do to you psychologically, physically, financially, and to your family and friends. Because eventually you are not just dating them, they're going to be dating your family and friends. So that's important. I think these questions can be landmines. Be very careful. Okay, we'll stop there. In next week's episode, we will cover relationship history. I want to thank you for sharing time with me tonight. I hope this was helpful to you as we progress through the psychological paradigm shift. Remember, you can go to the website, psychologicalparadigmshift.com. I will post updates when I have them, and you can sign up to receive future information. I look forward to next week's episode. Take care of yourselves.